Some anatomical sites carry special challenges, and the thyroid gland is certainly one of them. Several factors are important for success. The first one is the position of the patient. Hyperextension of the neck created by a pillow under the neck and shoulder area usually makes it more difficult to access the mass. This is because both the skin and the muscles become stretched and firm, hiding any deep-seated nodule in the neck. In my experience, it is easier to hold and palpate a nodule when the neck is relaxed. This can be achieved by laying the patient down flat or by putting a pillow under the patient's head. The second is stabilizing the nodule. Most nodules will be adjacent to the trachea, and the trachea therefore can be used as a support. The easiest way to hold the nodule is to use the fore and middle fingers on each side of the nodule, pressing against the trachea. If the nodule is large and extends laterally, make sure it is not covered by muscle. In order to push the lateral muscle aside, place the fingers medial. The third factor is the angle of the needle. In order to avoid passing through muscle and into the trachea, the needle should be tangential to the side of the trachea. The main reason the thyroid gland is a tricky area is its many blood vessels. The harvest will almost always contain a fair amount of blood. Therefore, I recommend doing fewer excursions with a needle, somewhere between 5 and 10. Do remember, though, that suction alone will not produce a good sample. The needle technique without suction, described earlier, often works well in the thyroid gland. Targets in the axilla may be difficult to reach and to immobilize. The best position for the patient is to be sitting up with the arms slightly abducted and as relaxed as possible. One way of accomplishing this is to put the patient's hand on the operator's shoulder like this. Another possibility is to have an assistant support the patient's arm in the same position. The patient in this position, it is possible to reach and sample most masses in the axilla. The mass is localized and then trapped against the chest wall with the fore and middle fingers. The thumb of the same hand is used to stretch and flatten the skin below the target to ease access for the needle. Access is made easier by having the operator sitting at the slightly lower level than the patient. It is important that the patient does not move away during the procedure. This can be prevented by giving the patient support in the upper back area. Another challenge is represented by masses under the sternocleidomastoid muscle. These may be large, causing the muscle to bulge, or small and difficult to detect under the muscle. In both cases, it is wise to avoid penetrating the muscle in order to sample the mass. Instead, the lump should be held by grabbing around the muscle, allowing the fingers to support it in the back, and the thumb to palpate it directly through the skin in front. Then, without loosening the grip, the thumb is allowed to slide down slightly, stretching the skin over the target. The skin is cleansed, and the needle is entered for sampling. The target may be sampled from the posterior aspect in a similar way. When aspirating small targets close to a vessel, the needle should be tangential to the vessel wall. Also, try to take advantage of the long axis of the target if there is one. This allows for longer needle excursions and therefore a better chance for good material. To avoid pneumothorax when aspirating small lesions on the chest wall, insert the needle at an angle. This is useful also in patients with lesions in small breasts. Breast cancer recurrence on the chest wall is often intracutaneous, very fibrous and thin. Use a 26 gauge or smaller needle and enter the target from the side. This can be quite painful, and I would recommend infiltrating with local anesthesia under the lesion. This concludes the demonstration of thin needle aspiration biopsy. I hope this video will be useful to you in your practice. Thank you.
Ответьте мне, пожалуйста, чему равен квадратный корень из 49?